Thank you for having me. Hopefully this is an interesting topic. It's, I think, become a lot more common in social media and the pop culture to talk about intermittent fasting. So hopefully we'll find this interesting and fun. So I don't have any financial disclosures to talk about in regards to this topic, but I do have a few comments and caveats. I would say that I'm not an expert in nutrition by any means. I think this is a very interesting topic, and I chose this topic because I wanted to learn more about intermittent fasting myself. So there are definitely people who may even be listening who know more about nutrition and diet than I do. But if you do, please chime in and let me know if I go astray. The other thing I would mention is that I grew up on a beef cattle farm, which my parents still own and operate, and I'm sure growing up this way and living on a farm will influence some of the diet choices that I make in my own life. And then finally, I'll be giving some of my own opinions on some diet-related topics towards the end, and opinions and philosophies in general. So I wouldn't claim that some of these have any scientific or published background for some of these comments, and they are my own. Just a word of caution too, as we talk about different diets and intermittent fasting in particular, that it may be harmful for some people with certain chronic diseases like diabetes to be on a fasting type of a diet, or those who suffer from eating disorders. And the information covered today is just meant to be a broad overview. So if anyone's considering making major changes to their diet, including extended fasting, they should talk with their primary care provider or a dietitian to make sure it's safe. As we talk about diet, I have to mention that the Mediterranean style diet is the one that has the most evidence for benefit in cardiovascular disease. And it's the one that's recommended by major committees in the United States, including the American Heart Association and others. And this is a diet that at the base of this pyramid is mostly filled with whole grains and fruits, vegetables, non-animal proteins that come from beans and nuts and legumes. And when you do have animal protein, it should mostly come from seafood and fish. It allows for occasional poultry or chicken and eggs and cheese and other dairy, but tries to restrict some other meats and other foods with added sugars particularly. So moving to intermittent fasting, as I said, it's become more popular in the last 4 or 5 years, and you see it if you start Googling around, you'll see many celebrities who've used this to lose weight or get in shape. This wasn't intentional, but over half of these pictured here are featured in superhero action movies. And so all of these actors and actresses have used intermittent fasting in the last several years in different ways, and some continue to use it as more of a long-term diet strategy. So there are different types of intermittent fasting. Intermittent fasting is kind of an overall umbrella term for changing when you abstain from eating. Some of the older versions of intermittent fasting are alternate day fasting, or a modified version of alternate day fasting. So this is where you do a complete fast every other day. So on your feeding day, you eat 100% like normal. And then on the fast day, you don't eat anything actually for 24 hours. So in a week, you'll fast 3 or 4 times. So this is one of the most strict forms of fasting, and is one that's not often maintained for an extended amount of time. The modified version of this alternate day fasting is one where you have a short window, about a 2-hour window on your fast days to eat a small meal, usually about 25% of your baseline calories. You fit in that small window. And then 2 more recent styles of fasting, intermittent fasting, include the 5 and 2 diet and the time restricted feeding. So the 5 and 2 is where on 5 days of the week, you eat a normal dietary allowance. And then on your fasting days, 2 days a week, you eat about 25%. So it's similar to this alternate day modified fasting, except there's only 2 days per week instead of 3 or 4, where you are severely limiting the amount of food that you eat. And then the time restricted feeding is the most recent version of intermittent fasting, where you can eat normally, but you just decrease the time frame or the window where you eat to less than, this says less than 10 hours, but it's typically a 6 or 8 hour feeding window. Now, fasting is by no means a new concept. Fasting has been around for many thousands of years and is a part of many major world religions, as you see listed here. One of the most studied type of fasting that's involved with religion is Ramadan, partly because it's so many people so many people practice this type of fasting, and it's been around for a very long time. So with Ramadan, it's a type of time restricted feeding. So even though I said that that is a newer type of intermittent fasting, it's just newer, and that's been named time restricted eating, or has become more popular in general, kind of the general public recently. But Ramadan is a type of time restricted feeding. However, typically, or with Ramadan, people fast from sunup till sunset, and then they eat their meals in the early morning and the late evening, versus the time restricted feeding eating that's most common now today is you eat during the daytime hours. And then Sunnah fasting is a type of fasting that was practiced by the Prophet Muhammad and was more like the 5 and 2 type of intermittent fasting, and usually the fast days were on Mondays and Thursdays. So some of the data around the Ramadan fasting has showed that there is weight loss during that month where people fast, but most of that weight is regained in the 2 to 5 weeks after Ramadan is completed. And there's been contradictory effects on metabolism when studying people who are adhering to Ramadan fasting. There are other examples of fasting in Buddhism and Judaism and Christianity. Buddhist monks fast from noon on one day to sunrise the following day. And that's a pretty consistent type of a fast during their training, at least. Yom Kippur involves a day-long fast. Orthodox Christians have 120 days where they have restricted diets, typically where they abstain from meat and dairy, among other things. So not so much a complete fast, but more of abstaining. And then there are other biblical examples of longer term fasting, 40 days fasting by Moses and Jesus in the Bible. So fasting in general has been studied for over 100 years. And in fact, at the University of Minnesota, there's a very famous old fasting experiment called the starvation study, which was done by Ansel Keys. And this work was done for the government, for the Department of Defense, or maybe they didn't have a Department of Defense back then, but this was to prepare soldiers for long-term kind of fasting in the field. And so the result of some of these starvation experiments here at the university, it resulted in what they used as K rations to feed soldiers in World War II. But as you see, research on intermittent fasting was much more sparse until the last about 5 years or so. When you search PubMed with intermittent fasting, you get about 750 results, and the vast majority come in the last 5-6 years, as you can see here. So what kind of benefits do you see on intermittent fasting? So most people, if they're going to start a diet, one of their main drivers is weight loss. So what kind of weight loss do you see with these different types of intermittent fasting? With the 5 and 2 diet, You can see a modest decrease, 4 to 8% in body mass, and but a big part of that is a decrease in fat mass. With alternate day fasting, a similar range of decrease in body mass, but the fat mass stays about the same. Same with time restrictive feeding, the decrease in weight is smaller, and it doesn't seem like it has a big impact in the fat mass as well. And these trials included both, again, the 6 or the 8-hour window, and they compared it to the 12-hour window. This is just one example of some more specific data from a trial that involved 88 women, and this was an alternate day fast where 3 days a week they fasted for 24 hours, and they were only offered some non-calorie drinks and a low energy broth. So pretty strict alternate day fasting. And the different groups were an intermittent fast group where they still got the total 100% of their baseline calories per week. So on the non-fast days, they ate in abundance, or they ate more than they typically would. And then they have a intermittent fast 70 where they consumed about 70% of the total baseline calories per week. And then they had a regular overall calorie restriction diet. So they can eat as they would or eat the same each day, but the total calorie consumption was about 70% of their baseline. And you see that you had the biggest weight loss in this intermittent fasting, the alternate day fasting group, who had 70% of their baseline calories, followed by the overall calorie restriction diet. And then the intermittent fasting, who still consumed 100% of their baseline calories, did have some decrease in weight, but it was a little more modest, and then the controls had no weight loss over time. So again, you see the weight is the biggest for the intermittent fasting group with 70% of their baseline calories. You see a decrease in fat mass in that group, again, for the alternate day. And then you have a bigger change in fat mass with intermittent fasting with 70% restriction. Now, one of the problems you might run into when you do these types of fasting diets is increased hunger. And you do see that with the 5 and 2 diets compared to just a daily calorie restriction. They had more hunger in the 5 and 2 diet. However, that hunger did seem to improve after a couple of weeks. With the alternate day fasting, there was again increased hunger compared to a restricted, just a daily calorie restriction. But those hunger cessations subsided after 3 to more like 10 weeks, so it was more common. So it took a little longer to get over or improve the hunger pains that were associated with this alternate day fasting. And there are some changes in hormones that regulate the feeling of hunger and the feeling of fullness. With the time restricted feeding, there's actually a decrease sensation of hunger in the middle of the day. So the dark solid line here is the time restriction, and then the dotted line is the control. And you see that there's a decrease in the middle of the day, but by the end of the day, hunger stays kind of elevated in the restricted feeding group, and it decreases in the control group. Same thing with fullness. You see the opposite pattern, where in the middle of the day, the people on time restricted feeding feel more full than the controls, but by the end of the day, the control group has increased fullness, and the time restricted feeding has decreased their fullness. What about cardiovascular health? This is a heart month, so how do these types of diets affect your cardiovascular health? So just in general, looking at the table, you see that there are some small to modest reductions in some of these cardiovascular risk factors, including LDL cholesterol, total cholesterol, blood pressure, albeit some are quite small and modest. But you see there may be a little bit better profile for different types of these intermittent fasting diets. So the alternate day modified fasting now had a little bit higher magnitude of reductions in these cholesterol parameters, and maybe even a little bit higher reduction in the blood pressure. Whereas time-restricted feeding had some of the smaller changes in these parameters. I would also note that these changes are from the baseline of the patients or the participants who are carrying out these diets. So this isn't a difference compared with the control group, because most of the data or the information we have on these diets is from studies where there weren't control groups. They took small numbers of participants, usually less than 20 for most of them, and they would test all of these parameters at baseline before they started, and then they would put them on the diet, and then after 4, 8, 12 weeks, they would recheck some of these parameters and see what the difference was from their baseline. So it's an important thing to note, because what we don't know from some of this data is if they were on any sort of calorie restricted diet, would they have the same decrease in some of these parameters? Or is there a specific benefit from an intermittent fast? And this data doesn't really show us that very well yet. This is that same small study, or relatively big study compared to some of the other diet studies, but of 88 women. And this one did include a control group where they were supposed to maintain an even amount of energy. And you do see that the intermittent fasting or the alternate day fasting group, who had a 70% of their total baseline calories, that group had the highest reduction in total cholesterol and LDL cholesterol, and compared to the calorie restriction diet, had a higher reduction in triglycerides. And you see that the other diets, intermittent fasting, where they had the same amount of calories, overall calorie restriction, where they had 70% of their baseline calories, they all had similar reductions in cholesterol compared with baseline. So really the intermittent fasting with a calorie reduction is the only one that showed some benefit in this one trial. So there are other metabolic effects that intermittent fasting can have on some of these parameters, like insulin levels in the blood, insulin sensitivity, glucose levels. So all of these indicators around diabetes. And there's much less data available for some of these parameters, but the most powerful change that we see with this type of fasting is an increase in insulin sensitivity. And what this means is that your cells may be more responsive to the insulin that is there to take up glucose in the blood. So what this may indicate is that some of these intermittent fasting diets may decrease the risk for developing diabetes. When you actually look at whether or not it reduces blood sugar, that data is a little more mixed. So with the alternate day modified fasting, there were studies that showed increased fasting sugar levels, decrease, or no change at all. Same with A1C, which is the longer term measurement of glucose. There was some mixed data. In the time restricted, there was some small decreases in both A1C and the fasting glucose, but it was not very, it was quite modest. So adherence to these diets can be difficult. Most of these studies followed people for maybe up to 12 weeks. There's a few that lasted longer, up to 6 months. And what they saw was when the diet changes stopped and they went back to their normal eating pattern, most of their weight was regained. And when they checked some of these cardiometabolic parameters like cholesterol levels and insulin sensitivity and glucose, most of those gains were also lost after they gained back the weight. The 5 and 2 diet did seem to have better adherence than the alternate day fasting. And in the short-term studies, close to 90% of people were able to stay on that diet. However, after they followed them for even a month longer, the dropout rate for these studies started to go up above 20%, and very few people were on continued to do a type of intermittent fasting after 6 months. So I mentioned that most of the data that were in those tables were from observational trials or trials where they just had one arm and they didn't have a comparison arm. They didn't randomize people to a control group for many of those observational studies. So this study was published in 2017, so only 4 years ago. And this study had a total of 100 adults, and they were overweight to obese, and they did not have any diabetes or cardiovascular disease. And the authors of this study randomized these patients to 3 different groups. They did an alternate day fasting group, an overall calorie restriction group, and then a control group. And the alternate day fasting were allowed to have 25% of their baseline calories on their fast day. So it was a modified version of this. And then on their feast day or their feeding day, they ate 125% of their daily calories. Whereas the calorie restriction group, they were meant to have 75% of their baseline calories on all days. So when it averaged out, they were supposed to have the same amount of calorie consumption. And this graph shows that they did get quite close. So between a 20 to a 25% reduction in energy or food intake or calorie intake for both of the groups, whereas the control group stayed pretty stable. However, what you see is in this graph, this is the alternate day fasting group, and the gray blue here is the prescribed energy intake. So they're supposed to have under 500 calories on their fast days, but they were closer to 1,000, especially as the study went on. And on their feast days, they're supposed to eat more than usual, 2,000 to 2,500 calories, but they were much closer to 1,500 to 2,000 calories. And when you compare that to the daily calorie restriction group, they were pretty similar on all of their days, or much closer to this group in terms of how much they ate for their feast and fast day. So the difference in the groups in terms of how they ate was not as dramatic or was not as pronounced as the authors had hoped, which may have contributed to some of the decrease or no difference in outcomes that the authors found. They did show weight loss, very similar amounts of weight loss in each group. Over time, that was maintained for about 12 months, but they didn't see changes in the cardiometabolic parameters like cholesterol and insulin and glucose. The one limitation or one explanation that the authors gave is perhaps these participants were too healthy. Most of them had normal blood pressures and normal or relatively normal cholesterol numbers at the baseline. And then finally, I would say that dropout for this study was quite high. 38% of the alternate day fasting group dropped out, 29% dropped out for calorie restriction, and even the control had 25% dropout over the length of the study. So this is it just shows how challenging studies looking at diet can be when you have to randomize people to a pretty restrictive diet. So that was an example of an alternate day fasting clinical trial. This is a clinical trial that looked at time restricted eating. So this is where you eat all of your meals or your calories within a 6-hour or 8-hour window. And this one also enrolled obese adults, 116 of them. They also could not have diabetes in order to be eligible. And they randomized them in a 1-to-1 pattern to this restricted eating group and then just a control group. So in this study, they did an 8-hour window of eating from noon until 8 p.m. And you see that adherence for this was pretty good. This is a 3-month, so this is a 90-day follow-up. At 90 days for the time-restricted eating, it was around 75%. So you still have 25% who are dropping out after 3 months. And the calorie-restricted group was closer to 90% adherence. So I like this type of graph because what it shows is just the spectrum of weight change that happens in people who are on different diets. So this is the calorie restriction group, and you have anywhere from an 8% decrease in weight to about a 3 or 4% increase in weight for the calorie restriction. For the time restricted eating, you have a little bit less dramatic of a weight loss in the high end, maybe 6%, but you have fewer participants here in the weight gain group, and again, it's about the 3% range. So the time restricted group actually had a significant overall decrease in weight, and the calorie restriction group did not. But there was no difference between the groups. So a decrease in weight from baseline for the time restriction, no decrease from baseline from the calorie restriction group, but the difference between the groups was not significant. So the other thing to note about the time restricted weight loss is that most of the mass that they lost was lean mass rather than fat mass in this study. So what are some pros and cons for trying a intermittent fasting? I think one of the pros and why people are attracted to intermittent fasting is that there's not a lot of restriction to what kinds of food you eat. It's mostly time restriction, whether it's a full day or it's a night fast. During your eating hours, you can eat kind of what you want, or that's how it's advertised. However, I think if you eat unhealthy foods in the windows when you are eating, you're unlikely to have any benefit, either from weight loss or from a cardiometabolic standpoint. There's some data that supports weight loss in these intermittent fasting groups. However, it's difficult to consistently maintain these fasting periods, especially the alternate day fast is a particularly challenging style of dieting. There's some cardiometabolic benefits seen in some of these studies, and they do seem to be, some are independent of weight loss. So even if you don't lose weight, by practicing some of this intermittent fasting, you might still see some of these metabolic benefits, particularly in that insulin sensitivity. But the cardiometabolic benefits likely do not persist after the diet is stopped and the weight comes back. One thing I didn't talk about with especially time-restricted dieting is that there's a link between how you eat and when you eat and your circadian rhythm. And by practicing some of these intermittent fasting diets, you may reset circadian rhythm, and there's been some associations with improved sleep patterns. But I think a big con with any type of diet, not just intermittent fasting, is that one size does not fit all. And that's evidenced by just the wide range of people who lose weight and gain weight on these different types of diets. So there's a review article in the New England Journal in 2019 that covered intermittent fasting and where I got some of the data for those tables. And this is one example that they gave for how to implement an intermittent fasting routine. And it really speaks to the challenge of adherence. So rather than just jump into a 6-hour feeding window or decreasing to 500 calories twice a week, they talk about a stepwise progression where you start with a 10-hour feeding window and then you decrease to 8 and 6, and then until you get to every day of the week where you have a 6-hour, or you cut your calorie intake by about half one day a week, and then you increase it to 2, and then 750 calories for 2 days, and then 500 for 2 days. And then they also encourage to take a food log. It can help with it can help you know how much calories are in each food that you're eating on those fasting days. You can track your own progress with your body weight and some of these other things that involve laboratory testing, but it can help to monitor your progress to keep you motivated and hopefully see some benefits. So moving a little bit to the opinions section. So I think when you're thinking about any changes in diet, it's important to identify what your goals are and understand what might help you achieve your goals and what won't help. Because if the goal is to lose weight, that might look a little different than if the goal was to decrease cholesterol or to decrease your glucose levels, or to decrease fat mass and increase lean mass. So I think it's really important to know, what the goal is and how you can achieve that goal. I believe that diet and exercise must be easily incorporated into your lifestyle to maintain discipline in the long term. I really don't like using the word diet. Because to me, diet implies a short-term, a New Year's resolution or something that you're doing, maybe a goal for a vacation or something. But if you're really focused on health and long-term health and cardiovascular health, the changes that you make in eating should last a lifetime, and they should be incrementally better. So in order to do that, I think you have to choose the type and the style of diet that fits your lifestyle. For some people, it might work very well to condense their eating to a 6-hour time frame. For others, it may not, depending on what their work looks like, what their home life looks like, if they have kids. So I think finding a way to as painlessly as possible incorporate it into your normal daily routine is what needs to happen in order to make it a success. And this isn't so much of an opinion. This is shown by some of these studies that if you can't maintain the changes, you'll likely lose most, if not all, of the benefits from the short-term dieting that you do. But if you make poor food choices when you are eating, then you'll likely offset the benefit from a calorie reduction or or any times of fasting. And lastly, different people will be motivated to healthy eating in different ways. So not everyone, some people might be motivated by the weight log or some of their feedback on what their blood levels are doing for their cholesterol levels or their glucose levels. Other people will be motivated by maybe their energy or their sleeping. So I think this goes back to what your goals are and how you can be motivated to maintain some of these changes. And then eating is more than just a calorie transaction. So meals are social activity, and I think it's pretty ubiquitous across cultures and religions. And I don't think we should lose sight of that in terms of how we eat or how we prepare our food or how we sit down and actually consume our food. I think it's very important. It's actually at the base of that Mediterranean diet triangle. It's not food. The base isn't food. It's actually the lifestyle. It's social eating. It's community. It's family focused. So I think that needs to be considered as well when you're thinking about any sort of nutrition or diet changes. And then there's joy in the act of eating itself. And I think that joy also needs to be emphasized and not ignored. And I think that there is obviously health related to eating, but mental health and joy from the act of sharing a meal and eating foods that you enjoy is an important thing to consider as well. So with that, I will leave this is just a few key references. There are others that I cited in the slides, but here are some of the major ones that I used to make this presentation. And then I'll stop there and see if anyone has any questions.
So I think there's one question in the chat. It says, I wonder, from Cynthia, I wonder if a study that combined intermittent fasting with counseling or support groups would improve the dropout rate. Did you come across any studies that did so?
Not off the top of my head. Most of the way that they did intermittent fasting, people were in the fasting groups. If it was limited calories on 2 days a week, or if it was complete fasting, they would do a lot of education to those. I don't know if they had specific support groups. There was a study that used an app to kind of remind people when it was time to eat or not time to eat. But I don't know, I don't recall if there was a counseling one. So for people who had to eat a certain way at a certain time, usually for the first part of the study, they would bring those people into the research center or wherever and prepare meals for them, so they could get a sense of how to cook the meals, what the calorie restriction looked like, and then after about a month, they would expect the participants to do that at home on their own.
Perfect. The next question, well, there's a lot of comments about, are those your kids? They're really cute. So there you go. But
Yeah.
although you say that there's no one size fits all solution as a prevention cardiologist, how would you advise a patient who asks you about fasting versus a traditional diet to achieve weight loss or an improved lipid profile, or both?
Yeah, so it depends what you mean by a traditional diet. So no matter how people choose the timing for their eating, I still emphasize that the times when you are eating, you should follow a Mediterranean style diet. So I think that in general, having a more plant-based, more high fiber, less preservatives, less added sugar, lower sodium diet will give you health benefits. And if you're looking to lose weight and it works to restrict calories, to do an intermittent fast or a time restriction, I think that's great. I think if you can just calorie restrict through the whole day and eat a normal 3 meals a day, I think the benefit is probably pretty similar between those two for weight loss. That's been shown by a lot of the studies. So I think it probably depends on what makes it easier for the patient. If condensing things, or one thing I talk about is the meals that you eat or food that you eat after dinner late at night are often unhealthy snacks. It's usually not something you're making fresh. It's usually not fruits and vegetables. So if you stop eating after 7 p.m. or 8 p.m. for a time restricted eating, and you're just not eating those high calorie, high sugar foods, then that's probably going to be a benefit.
How about, so when it says no eating or drinking, does that include water and coffee?
No, so most of the fasting diets, you can have non-calorie beverages. So water, coffee, teas are all usually allowed.
How about, do you still eat meat?
I do. Yes. I think that goes back to for me, that goes back to the joy of eating.
Yeah.
I eat less beef than I did when I was growing up, but I still eat beef, and but I do eat many more vegetarian meals than I used to.
How about, what is the effect of medication absorption during a fast?
That's a good question. I actually don't know the answer to that. That's a good question.
All right, let's see. Do you know if any of the participants were exercising during the fasting?
So most of the data, there wasn't a specific exercise program. They were often counseled on exercising as just part of kind of a healthy lifestyle and what the general recommendations for physical activity are, but it wasn't part of an intervention for those. There are studies that looked at like adult athletes, not professional athletes, but active adult athletes, and there may actually be some benefit to an intermittent fasting type diet for athletes. And again, in some of those, they actually didn't see much weight loss, but they saw some transition between decreased fat mass and increased lean mass.
How about what is your experience with SGL2 and GLP-1 inhibitors for aiding fasting and weight loss?
Yeah, great question. So I'm starting to advise or recommend these medications more and more. In my preventive cardiology clinic, I see less people with heart failure, but obviously the SGLT2 inhibitors are becoming, if not first line, one of the very first medications that are started for heart failure patients. But for those people who don't have heart failure, but have a history of coronary artery disease and diabetes, especially the combination, I am recommending that they start SGLT2 inhibitors. Is usually my first choice. And then if there's more concern about weight loss, then I'll usually recommend the GLP-1 agonists, as there's more data for weight loss in that category.
All right, so we have a few more questions. Have you looked at, okay, I'm going to butcher this word, autophagy? How do you say that? And the effects fasting has on the body, fighting things off and aging.
Not in detail. I did, when I was looking through, there are some kind of general comments on aging and but I didn't get into specific what the cellular mechanisms are for and how those change with fasting. There's more data for that in mice and rats than there are in humans, and I didn't delve too deeply into that, but there are data like that out there, and again, mostly in mice and rats that I saw in my brief kind of pass over.
So one person asked, we often find that patients that are trying to lose weight for transplant have a hard time with cooking in general. Are there any resources at M Health that help support patients with cooking and meal planning that you know of?
I don't, off the top of my head. I mean, so there's a dietitian consult. We have a department for that. Unfortunately, it can be hard to get that covered by insurance. If people have diabetes, that is a covered diagnosis for a dietitian consult. And often that's part of their routine care, and they're often plugged in already. But sometimes people with diabetes get a consultation when they're first diagnosed, and with everything else that's changing with diabetes, it's often overwhelming, and it may not be a bad thing to reconsult, several years later. So that's one thing. There used to be a program called Ways to Wellness that was based in Woodwinds, but that I heard recently was a fatality of COVID, so that has been canceled.
It's actually where they do their COVID shots now, in the Ways to Wellness building.
Yeah, so it was a great program. They actually had a kitchen, an industrial like chef's kitchen with multiple stations, and there's a chef, and they would do kind of group teaching. So hopefully something like that can come back again. I would love to see that as part of a kind of a comprehensive prevention clinic or prevention program, but so far, not right now.
So I have two last questions for you. Do you feel a plant-based diet is sustainable in American culture?
Well, sure. I mean, there are plenty of people who live in the United States and maintain a plant-based diet. I think people can do it, and there are many options. Yeah, I mean, there's a huge variety of food you can make that's plant-based, and so yes, I think it is. It's I don't. Kind of the flip side of that question maybe is I don't think meat is going away. I don't foresee a plant-based being the dominant diet in the United States anytime soon. But as I said, I think small incremental changes are that are sustainable are much more important than wholesale change. So I'd rather see, everyone take one step and add one vegetarian diet to their regimen each week than to see huge changes to plant-based that can't be maintained over many years.
Yeah. And my last question here is, do you feel there's enough research that has been done regarding intermittent fasting to adequately determine its effectiveness?
No, probably not. That's the easy thing to say, is always, no, we need to do more research. But in general, the trials are small, and there are big limitations, both in terms of who's being enrolled in the trial, because there may be some subsets of people where there is more benefit. And follow-up is an issue. And then the types of intermittent fasting vary. So I think there could definitely be more done. Any diet trial is very challenging, because it's hard to get people to maintain a very specific, rigid diet. And that's kind of what you need to do these clinical trials. So if there's too much variation in what the intervention is or the exposure is, then the outcomes vary widely. And you kind of see that with the difference in weight loss and weight gain in the same arm of the trial. I also think that there's evidence of the one size does not fit all, and there are certain diets that will work better for certain people. So the future may be in more focused research on metabolomics and proteomics to see what types of micro and macronutrients affect people more based on their genetics. I think that could be a very interesting future area of research.
Great. Well, thank you, Jeremy, so much for your time today. Thank you everyone for attending. We're so glad you could come. I'm sure if you have other questions, you could, I'm sure, email Jeremy directly. I'm sure he'd be happy to help you and answer those questions as well.
Yeah, no problem.
I did put in the chat a link to our cookbook. So we are selling a cookbook for Heart Month, and we would love for you to order one. I can't assure you that it's like all Mediterranean diet stuff, but they're all heart healthy, but there are heart healthy recipes in there as well, other tried and true recipes. So please order one, and we're hopefully going to start distributing those later this week. So thank you everyone for attending. Anything else, Jeremy?
No, thank you very much, Kristen.
Yep, thanks. Have a great day.
Thanks. Bye-bye.
Bye.